Being referred to look for medicine in pharmacies is a challenge patients and citizens are still experiencing when they go to hospitals and health centers. They say this is a challenge that has been existent for some time now that ultimately slows down healthcare service delivery. This is quite a big challenge for us. We spend lots of transport. To go to Sehashka, you don't take a bus. You have to take a motorbike to go look for pharmacies to get the medicine from outside. There are times we are prescribed medicine that is not available in the hospitals, and we are referred to go buy it outside, which is extremely expensive. Doctors too are in agreement that this affects the way healthcare services are delivered. We don't have factories in Rwanda that make drugs. Most of the medicines are sent from outside the country, which also causes delays. But the Medical Procurement and Production Division at the Rwanda Biomedical Center, district pharmacies as well as district hospitals have the same problem, which needs to be solved. The Director General of the Rwanda Biomedical Center, Dr. Sabine Nsanzimana, says that in their plans to solve the issue, there's a law that was put in place for the Rwanda medical supplier to be able to distribute the drugs on a timely manner. However, when the implementation starts is not known because the institution doesn't even have employees yet.
Imiti iva ku rwego rw'igihugu ikajya mu pharmacies y'uturere akaba ariho imiti.
Drugs come from the national level to district pharmacies. From there, they are dispatched to district hospitals. So if the district pharmacies and hospitals work together, the Rwanda medical supplier will help bridge the gap and take out the different institutions that were supplying medicine at very expensive prices. It will also be able to buy the drugs directly from the suppliers and be able to distribute them in hospitals through the district pharmacies. This will help the citizens to easily access the medicine whenever they need them. In a bid to solve the issues of long lines in hospitals that ultimately affects healthcare service delivery, Rwanda Biomedical Center says they are going to embrace technology that will help patients register and move away from the traditional ways of writing in books. Up to now, Rwanda doesn't have a factory that manufactures drugs and some equipment used in hospitals. It is private companies that are usually given the license to import them from outside countries, which is a long process and takes long to reach Rwanda.